We're also taking your questions to our medical experts right here in the Valley. Our first question, how does COVID-19 compare to SARS? We asked Dr. Frank Lavecchia with Valleywise Health Medical Center.
You know, SARS is very deadly. SARS is actually more deadly than COVID-19. And I think places in Asia learned some of the lessons firsthand from SARS. And they learned that they should be better prepared for it, better screening if this happened again. The country, had stockpiles of stuff. The major difference, though, for us and why COVID-19 is so much harder is that I am asymptomatic for a few days. I have no symptoms for a few days. Then I develop my fever on the third, fourth, or fifth day. Those first 5 days, I could have given it to you. SARS, you were contagious once you developed your fever, once you had symptoms. So it was easier to isolate you. Now we're practicing isolation on people who have nothing, no signs or symptoms. So it's a little bit different. It's a little bit harder for us to control because of so many asymptomatic people.
Our next question, when taking someone's temperature to check for a fever, what kind of temperature is a cause for concern? We took that question to Dr. Andrew Carroll, who sits on the board for the American Academy of Family Physicians.
So the temperature you're looking for is 100.4, and in a child and an adult, that's 100.4 orally. Okay, the ear thermometer is not really great. The forehead thermometer is definitely not very accurate. So make sure you're getting an oral temperature. On infants, you want to do a rectal temperature, but the number is the same. It's 100.4, and so if you're above 100.4, we consider that a fever, and then you need to start to look at the other symptoms.
All right, our thanks to both doctors. Remember, we want to answer your questions, so post them on our 12 News Facebook page or text us 602-444-1212. And download the 12 News app for all the facts, not fear information on the coronavirus.